So hello everybody, my name is Monique and I'm going to be your host today for Where Can Your Degree Take You? An online event, part of the exciting new online series exploring fantastic careers and options available to you at the University of Southampton as a graduate. My name's Monique Cleary and I'm a second year podiatry student at the University of Southampton. I'm a mature student, I'm on my second degree. My first degree was in fashion management. As a mature student, the University of Southampton offers amazing opportunities, and I'm diving within podiatry into a kind of a path of leadership and entrepreneurship. So I'm part of the Council of Deans, 150 leaders, which students can apply for. I applied for it in my first year and took part of it in my second year. And I've recently returned from Nashville, Tennessee, where I was taking part in the Clinton Global Initiative University, which is for social impact. This summer, I'm hoping to gain a place on the university's foundership, so that's a part of the University of Southampton, and that programme supports students making business ideas into reality, and that's also fully funded by the University of Southampton. After I graduate, I'm considering I'll definitely work for the NHS at some point, considering starting my own business within podiatry, or maybe doing a PhD after I graduate within University of Southampton again. The University of Southampton is passionate about the degrees they have on offer and helping students find exciting and inspiring careers. And this event gives you a chance to hear from amazing recent graduates in subject areas that you're interested in healthcare, as they talk about their experiences and how they've used their degree to positively impact their careers. We'd love to hear from you and any questions that you have for our speakers today, and or for me also. So at the top of the screen, there's a Q&A button. You can direct all your questions up there, and please like any questions that you've seen anyone else post, and we'll read those ones first. Throughout this session, your cameras and your microphones won't be able to be on, so please direct any questions up to the Q&A and we'll try and get to as many as we can once we've interviewed our speakers today. So what we're going to do is a quick introduction with both of our speakers, and then we'll do a more in-depth question and answers with them to see how their time was during their degree and what they've gone on to do. So without further ado, it gives me great pleasure to introduce to you Maddie, who studied podiatry, and Kish, who studied cardiac physiology. But we'll start with Maddie. Could you just introduce yourself and let us know what you're currently up to since you graduated from the University of Southampton?
Sure. Hi, everyone. Thank you so much for having me today. Yeah, my name is Maddie. I graduated with a bachelor's in podiatry in 2015. Since then, I've been working in London, training to be a podiatric surgeon. I still work at West Middlesex Hospital, where I started my training, and I'm currently a specialist registrar.
And Kish, do you want to introduce yourself, please?
Good evening, everyone. My name is Kish Ter, and I studied BSc in Healthcare Science in Cardiovascular at the University of Southampton. I graduated in 2015, and currently I work as a Chief Cardiac Physiologist at Frimley Health Hospital.
Fantastic. Brilliant. Thank you. We're going to start with Maddie. So you are still at the hospital that you've been at since you finished your degree. When did you finish your degree? And what does your day-to-day look like as a podiatric surgeon?
Podiatric surgeon, yeah, that's right. Or the long way is podiatrist practicing podiatric surgery, but that's a bit of a mouthful. Yeah, so I've been based at West Middlesex Hospital since I graduated, and I've worked my way up from being a podiatrist up to specialist registrar in surgery. So my week looks like I have a full day in theatre, and then I spend the rest of my week in outpatient clinic. So that would be seeing new and follow-up patients, those that perhaps want surgery or those that have had surgery. I am part of an acute care hospital trust, which means it's a big, busy hospital. We see a wide variety of patients with from anything from minor to quite severe problems, and that could be from the diabetic foot to infection, bone infection, all sorts, basically anything and everything, foot and ankle is what I do.
Okay. Any highlights in your career so far? What's the best thing you've done so far in surgical world?
Well, I suppose passing my exams was a huge amazing experience. I'm so glad to have got through it. It was pretty stressful at times. I've spoken at an international conference in America. I won a prize at the Directorate of Pediatric Surgery conference on my research on metatarsus adductus and hallux valgus treatment. So basically bunion surgery. So yeah, it was probably a big highlight for me. I did that when I first started as a trainee in pediatric surgery. I still do a lot of teaching, a lot of mentoring, and that brings me a lot of joy.
And are you, as a pediatric surgeon, what are your hours like? Are you having to do shift patterns, or is it 9 to 5, Monday to Friday?
It's a little bit in between. So I do the same sort of time frame each day, each week. So I do either early starts or late finishes. When I'm in theatre, my day normally starts about 7 a.m. and finishes anywhere between 5 o'clock and 7 o'clock in the evening. And then one day a week I do a late one, so that could be 9 a.m. to 9 p.m. But generally the same each day, each week.
Brilliant. Manny, could you give us a bit of background? What did you do before you started your degree in podiatry? What did you study science at school? Is this what you wanted to do? Had you always wanted to be a podiatrist or not?
No, absolutely not. Quite frankly, I hadn't even heard of it until I was 21. When I finished school, I went straight to uni in Leeds and I got my degree in biology purely because that was my favourite subject at school at the time. I had absolutely no idea what I wanted to do. And it wasn't until I started researching healthcare careers that I discovered podiatry. So as soon as I finished my biology degree, I finished in June and then started at Southampton in the September. So no, it was not something I dreamed of as a child, but I love it now.
And the surgical route, was that one that once you started studying podiatry that you knew you wanted to go on, or was it because the university has that link with a surgical placement once you've graduated?
Yeah, while I was a student, no, it wasn't something that was at the forefront of my mind. I was interested, but it wasn't sort of my absolute goal. It wasn't until I was in my final year and my current tutor, that my consultant that I work with, came and did some talks at Southampton. I visited, I did a few weeks of work experience and sort of never left. That's what inspired me, really. So in terms of surgical training, you generally have a couple of years in clinical practice and then you can start your surgical fellowship. So it goes sort of 2 to 3 years as a trainee, 2 to 3 years as a registrar, and then you get something called your completion of podiatric surgery, which is essentially a portfolio of showing how many procedures that you've done. You have to do a number of rotations, exams, and publications in order to finish your training. I'm almost there.
Yeah, that's amazing. So obviously Southampton really influenced the direction you went in with your career, and obviously that speaker influenced you. But was there anything else within the university, so particular events or societies that helped inspire the career direction that you've gone in?
I wouldn't say there was anything specific. Being at Southampton, I really enjoyed studying podiatry. I enjoyed going on placement, but I knew I wanted more. I wanted to be challenged. There are lots of different routes in podiatry that you can go down. You can specialise in lots of different things, which is one of the beauties of podiatry. But as soon as I got the bug for surgery, I knew that that's what I wanted to do. I wanted more challenges. I wanted each day to be different. And that's sort of how I came into it.
So your time out Southampton, how did you find it? Any societies that you're a part of, and did you get to do any placements while you were at the university?
Yeah, so unfortunately, no, I wasn't part of any societies. I was technically a mature student. I lived at home, so all the socialising I did was sort of while I was at university. In terms of placement, yeah, it's in the podiatry degree, you have to do a placement each year, which was always great fun, particularly if you were paired with someone else on the course, which often happens, and you go down together. It's almost like a little holiday. The furthest I went, gosh, I did sort of Portsmouth, Southampton, so the local ones, and then Andover in Wiltshire, I went there as well. But yeah, placement was always good fun, and it's how you could really see what it's like working in the NHS.
And while you were on placement, did you get to see surgery, or was that something that you only got to experience in your third year?
No, actually, I didn't. There is one surgery placement in Sheffield. I didn't get to go. So my first experience was actually when I was in my final year, and I went to spend some time at West Middlesex Hospital. So it wasn't technically a placement. I took myself off there in my own time, and that's how I first saw surgery. And I didn't even know that that was possible. You know, being a non-medic, being a surgeon, it didn't make sense, but yeah, that's how I got into it.
So once, going to go back to your career path as you're on, once you've almost finished your fellowship, what's next for you now? Do you have to move onto a different hospital? Do you get a change of job title? How does it work?
Yes, so I'll almost certainly move on. It's quite unusual actually to stay in one hospital throughout your whole training. It just so happened that right place, right time, and that's how I ended up staying at West Middlesex Hospital. The next stage would be consultant. So I'm almost finished my registrar training, so I'll be applying for my completion certificate probably later on this year, and then I can apply for a consultant post, which could be anywhere in the UK. You know, it's not a huge profession. There's not that many of us, so it could be anywhere essentially. So you've got to be kind of willing to move, or be patient and wait for a role to come up near you, and who knows, I just have to watch and wait.
So the question is, any tips for someone that wanted to take this route and do the surgery? Like, do you think that they're at a benefit from going to the University of Southampton if this was a route that they wanted to take?
Absolutely. The University of Southampton has a direct link with West Middlesex Hospital, and Professor Tago often comes to do lots of talks, and he invites people to come and spend time. So the University of Southampton is definitely a great place to study. Not necessarily if you want to do surgery, even if you just want to come and see what we do, then it's a great sort of pathway into it. Yeah, certainly. Yeah, certainly. It's University of Southampton's great for that.
So if you weren't on the surgery route, is there another part of podiatry that you feel that you would be interested in, and what type of careers can you have from podiatry if you weren't in the surgical path?
Okay, sure. So you can do purely sort of routine foot care. So that's mainly working with the elderly. You can specialise in the diabetic foot or the high risk foot. So that's going to be a lot of wound care, managing infection. Generally, when you work in the diabetic foot, you'll be part of a multidisciplinary team. So working alongside the diabetes doctors, radiologists, microbiologists, and it's very much a teamwork type setup. You can also specialise in MSK, so biomechanics. That will be more sort of sports injuries and things like that. And there are a few paediatric specialists as well. And finally, rheumatological specialists, so those that work with inflammatory conditions, rheumatoid arthritis, psoriatic arthritis, and how that affects the foot. There's loads you can do.
Brilliant. And so you like your career then, yeah?
I do, yeah. It's very challenging, it's tiring, but I wouldn't change it. Yeah, I absolutely love it. I think it's what I was supposed to do, and I've only just worked that out, and I'm sort of 31, so you don't always know when you're very young what you want to do.
Brilliant. Thank you so much. That was so insightful. So really helpful to, I'm sure, lots and lots of students. So we're going to go over to Kish. So Kish, could you let us know what your career journey's been like so far since leaving the university and what you do on a day-to-day basis?
Hi, my journey, well, it's been a roller coaster, that's for sure. So when I graduated in 2015, it's been really great, and this is something I always wanted to do. And I'm originally from Mauritius. I started my nursing career there as in cardiology, but then when I came to England in 2003, and that's all I wanted to do, cardiac physiology. But it took me a long way before I managed to get here. So prior to apply to the university, I had to go, because I was out of education for such a long time, so I had to do an access in science to get all the grade so that I can apply for the degree. But as a job day-to-day basis, I must say every day is different. So I do free specialism in ultrasound echo of the echocardiogram and cardiac rhythm management, where the pacemaker, ICD defibrillator, and heart failure device. As a physiologist, we help the doctors to implant and program them, and we also do follow-up clinic independently. And so the patient doesn't see the doctors when they do their pacemaker follow-up, they see us as physiologists. We make changes. Then if we need to refer back to the doctor in regard of medication, then we do that. But otherwise, we run the clinic independent. And other things that I do as part of the day is work in the cath lab, where patients have their angiogram, where they have narrowing the coronary artery, where the doctor uses a balloon and then they can put a stent as well. And we are part of the multidisciplinary team where we have heart attack for patients that come in with heart attack. So again, there will be a team of radiographer, nurses, doctor, and physiologists. We're part of that team as well.
So I want to know, especially, is it a 9-to-5 job or is it shift work? Do you have to do weekends and evenings?
So it is a 9-to-5 job, depending on the hospital. Sometimes some hospital will do, depending what service they provide. It'd be Monday to Friday, 9-to-5, and some hospitals do 4 long days for their staff. But again, independent hospital, they do primary services for heart attack. For example, where I am here at Frimley, we do offer the service, so we have to do on-call 24 hours a day, and also over the weekend. So this weekend just gone, I was on call from Friday until Monday morning for emergencies.
But that you're not necessarily working over the weekend, you're just on call.
Yes, you're just on call, you call in for emergency only.
Brilliant. Just making sure that you get to have a social life, Kish.
Oh.
So career highlights. Obviously, you had the nursing career before, and then you've really specialised in this career. So have you enjoy it? What's been the career highlight so far since qualifying?
I think I was very lucky in terms of my dissertation. When I did an ECG lead placement. So I did present it at 3 conferences in the UK, and which really raised awareness of the ECG lead placement for cardiology and also with other profession. So that was one of the highlights, definitely. And being cardiology is a very small world, I must say. You will meet lots of people around, and you will share your knowledge as well a lot. And the other thing, in 2019, I believe I had a Rising Star Award for what I do. So again, it's little things like this that do help. And with cardiology, again, as I mentioned it earlier, there's different specialism. You can also do adult and pediatric as well later on. So with the pacemaker and ultrasound and cath lab. So yes.
So can you give us I was going to say a bit of background, but you've already told us you studied nursing first. Did you do science at school? And how did you find doing your degree in the UK versus to doing it studying elsewhere?
So the first degree I did here in England is definitely, when English is not your first language, it's quite hard to get into it. And but I must say, there's so many facilities here at the university. They offer so much support to the student with any sort of language and writing and everything. So that was really great help for me. And also all your colleagues that you have as well, they're great support, and your tutors. So the degree itself, it was nicely planned in terms of 50% of them was theory and 50% placement. So throughout the 3 year, you will have different type of, you will have your theory and then your clinical skill at the university train before you go on placement. So you're well prepared for that, that's for sure.
So how did the university or your time at Southampton influence your career direction? So you said you did your dissertation and you got to speak about that. Was that the thing that pushed your career into a certain direction?
Well, it's all depends. I was very open-minded because I wanted to do all the three specialism, because the more you can do, then it's easier for you to understand how your patient is. Because some patient who has, every patient in cardiology will end up having a 12-lead ECG. So that's the bread and butter of cardiology. So for me, that was, I think there was a good opportunity for me to raise awareness of good practice, and that's where I went for my dissertation and raising awareness. And also, I think we everywhere, all students, we do lots hard work. We put in our 3-year degree, 4-year degree, and we produce good dissertation, and we don't get a chance to publish it. So why not? So I said yes.
Do you think you'd be in the position you were in today if you didn't go to the Southampton University of Southampton?
Definitely not, because I'm not being biased or anything, and I take lots of pride where I've learned and studied, and Southampton did give me that clear pathway where I want. And the key factor for Southampton University for the healthcare science degree is the teaching that we get at the university and the clinical skill lab. You're well prepared before you go on placement, and you can see the difference between other universities students. That I know I'm being biased here, but having worked in different hospitals and receiving different students from different universities, I can confidently say that.
I've heard the same thing, so we can all be a little bit biased because I've had the feedback as well. Compared to other universities, they say that we're well prepared, even in the first year and the second year, and I'm not even a third year student yet, and we get compliments. So, yeah. How did you find your time at the University of Southampton? So you said you got support with the writing. What else did you like about being at the university that's not necessarily academic?
So, sorry. So the good thing was absolutely, it's just the cultural stuff. So you meet lots of people, making lots of friends, and try different food, that's for sure, from different cultures. So that was the highlight. As a mature student, I didn't live the student life, going clubbing or anything like that. I'm boring that way. But my background outside the cardiology is beach football. I'm a professional beach soccer referee. So that's been a bit, and I push most of my time being spent into that, traveling around Europe to do that. But again, with the cardiology aspect of it and the sport that I do, it merged both together, and currently that's helping me doing a master's in sport cardiology. So merging passion and hobbies together. So loving life.
No, it sounds great. Did you get to take part in any societies? Is there a beach football society at the university? I don't know.
No, unfortunately, no. I did try, but with the we don't have 30 degrees in Southampton, do we? And so definitely that. But I did try futsal though, which was good, and playing indoor football, which was good laugh, that's for sure.
So any other university events or particularly memorable parts of your university experience? I'm not sure if your course offers any internships internationally or abroad. Did you get to travel with the university?
Not on this time, because it was so the degree before it, I was one of the pioneer for the PTP, which is a practitioner level, because in modernized they changed the degree. Before it used to be fully funded by NHS. They used to get employed and then you get paid to go to uni. So this PTP now, since it's changed in 2010, then what happened, the student have to pay the fees. So that's where everything changed. So then we don't get the opportunity to go abroad or anything. So.
Okay. Then any advice, did you live on campus or did you stay at home when you came to university?
No, I stayed at home. So I used to live on the Isle of Wight. So my journey was to cycle, get the boat, then get the train, then cycle from the train to the university. So that was my chores 4 days a week to the uni.
That is some dedication. That's amazing. Wow, you should have got an award just for that. But then so that it just shows that you can do all that commuting and traveling back and forth and still graduate with an amazing degree. So it's a possibility if you have got a long commute.
I think definitely, and the degree overall, I would say I do encourage. So there's many students who want to do medicine. If they can't get into medicine, this is the best degree to do, because you come out with a good, decent career with it if you can't still get into medicine, and you can still specialize in so many different aspects of cardiology. And there is so many opportunities in this degree, that's for sure. And I proudly can say I love my job, and I'm in a position to say that. And so yes, and being part of this job to contribute to saving people's life is just great.
You sound very passionate about it, which is great. Do you have any advice for someone that's interested in entering this similar career path that you've taken? Any advice to prospective students thinking about going down this route and path?
Definitely, and I think what I would advise is if you're interested in this, contact your local hospital, go visit their cardiology department. And that's important because that will give you an insight. Even spend a couple of days there, or a few morning, anything. This will give you a good insight of how the department work, how different the staff work and the pattern. And all that can go down your personal statement, because all this add. And even if you care for somebody at home, your family, all these will add benefit to your application. But at the end of the day, I'm a big believer. I'll be very honest with you. I don't believe in first-class degrees or anything, because for me, as far as you understand what you're doing, theory, and then you can apply this in practice and clinical setting, and that's what matters most. And you are safe, your patient's safe. That's good.
Brilliant. If as a young student, do you know how old you're allowed to be in order to do an observation in a hospital in a setting like where you are? Do you know how? Because I'm sure there might be some students listening that might be 16. Would they be able to observe, or are they too young? Do you know?
Yes, 16. So we do have students with work experience from the college do come and visit us. So they need to go through the educational, do all the paperwork and everything. But yes, they do can.
Brilliant. Well, it sounds great, and thank you for all of the insight. It's been wonderful. I'm going to go to the Q&As above, but is there anything you wanted to add as a final advice to anyone, any students that were applying for these courses?
I think definitely, again, I will go again. It is a very good course, and it will take you a long way. And don't get me wrong, we have a growing older population. The people get heart disease all the time, and hypertension, diabetes, all these contribute to heart problem, and there will be a job there for you for life.
And Maddie, have you got any final bits of advice for students that are considering podiatry?
Yeah, actually, just as a sort of follow on from what Kish was saying about sort of, I would describe it as these are alternative careers to medicine. It's certainly not second to medicine or a backup. We have excellent careers in our own rights, and we work alongside the medics, and we're certainly not sort of second to them. So working in healthcare is so rewarding, and it's flexible, and as long as you want to help people and care for people, I would absolutely encourage you to work in a health related career.
If I wasn't already attending, I'd want to attend. You've been so inspiring. So I'm going to go up to the Q&As, and we've got a first question. Everyone's anonymous, so I can't give anyone credit, sorry. But as someone who's looking at physiotherapy and probably in a sporting sector, I'd be open to other options. I'm wondering if I should go straight for a physiotherapy degree, or if I should try sport and exercise medicine or something similar first. I've got an opinion on this, but I'll leave it for last. Maddie, oh no, Kish, have you got an opinion on this, or Maddie, either or?
Yeah, I mean, I would say both excellent careers. Physiotherapy is going to give you the more broad training, and then you can specialise in sport science. You may find that actually once you start your physiotherapy career, something else captures you, like respiratory physiotherapy, for example, or paediatrics. So you can then choose to specialise in sports and exercise science, but you can start off a bit more broad. That's probably what I would do. But, you know, follow your passion. If you know that that's what you want to do, go for it.
Kish, any opinion? Yeah, go ahead.
Exactly, just follow the passion. Just think where your forte is, where you feel comfortable, and again, like I said, I'll go back into observing, go back in the hospital and observe this type of scenario and get as much as feedback as you can, and this will help you more. So yeah.
So my take on this question is, as first year, second year students doing podiatry at the University of Southampton, you can go as a podiatrist to the London Marathon, and we help injured sports people at the end. And MSK within podiatry is a specialism where there's a massive shortage. So if you're really interested in running, this is like a really easy way, because there's not a lot of podiatrists, and then to narrow down, and the people that specialize in MSK, there's so few people doing this. So if you're really interested in rehabbing footballers who always have broken metatarsals and they need to rehab, they have podiatrists that rehab them, not necessarily physiotherapists. So, you know, and when you apply for these jobs at sports clubs, you're not up against anyone. It'll be easy for you to get these roles because there's just so few people specialising in podiatry. So
that's a really good point.
And also when you do MSK podiatry, you aren't dealing with wounds. You will have to learn wounds, and you will have to learn about diabetes and heart problem when you do your degree. But when it comes to you actually doing sports MSK and rehabbing on where people are running or unable to walk after strokes, there's no open wounds, guys. So if you're like, oh, it's feet, actually you're just saying to someone, you're giving people advice on how to move. You're not necessarily touching people's feet full time. So give it a bit more consideration. And as these guys have said, go and observe someone. There's lots of these in private clinics. You get to learn ultrasound as well if you do this. Yeah, it's a really simple and easy path if you're interested in physiotherapy. Okay, so the next one, in the university, what is the best subject provided, and what are the facilities there? I don't, guys, you graduated a long time ago, but I know for physios and podiatry that there's a mix of we've got a special unit in the university currently where it's like 3D walking and you put little monitors on like you're going to be an avatar. So, and you can monitor how people walk. So technology like that is there. But guys, do you remember anything from your training of the facilities that were there or the best subjects while you studied?
Well, it's renowned for health sciences, isn't it, Southampton? I certainly remember that when I was applying and looking around. Obviously, I can only come at this from a podiatry perspective, but when I was researching where to do my podiatry degree, there was absolutely no contest, you know, in terms of the teaching standard, the facilities, the placement program, the hours. The university campus, if you haven't already been, it's got everything. We've got the union, it's got a great gym, all the high tech you could possibly want, and it's a great student town as well. So yeah, from that perspective, I don't know about this avatar thing, but I'm sure they've got it.
I think definitely with the university down the south, so the setting with the cardiothoracic that they have at University of Southampton Hospital, that's another thing. You get the chance to go to watch open heart surgery as well as part of the degree, and having the aortic valve replaced or coronary artery bypass. So that's a really good opportunity to also see this kind of procedure will happen. But let's say we are down the south, sunny south, you can't go wrong with that.
What's the worst thing about health sciences that you've encountered either in university life or in the workplace?
Well, I'd have to go with workplace. I can't think of anything negative from from health sciences from a degree perspective. When you work in healthcare, you're always going to be presented with really challenging patients, whether that's sort of from a personality perspective or they're just very, very poorly. And sometimes it can be sad. Lots of people have different experiences and backgrounds, and it can really pull at you, pull at your heartstrings, I suppose. So what I would say is there are situations where you need to try and not take it home with you, which is difficult, particularly if you are sort of a sensitive, empathetic person. You've got to be mindful that you can't take on everyone's problems. And I've seen some really, really awful, you know, limb loss and things like that, which have a huge impact on people. So yeah, I couldn't name anything specifically, but come up with lots of challenging situations like that.
I think again, like you mentioned, Maddie, it's I work in emergency area where I see patient come in very poorly. Most of the time, the patient make it back, and there is some odd time where we did our best, and we can save the patient life. So that is sometimes that can be hit you down a lot. So I think one thing definitely in the healthcare profession in this is you need to talk. You need to debrief your mind and always have somebody to talk to, because that helps a lot. Because don't keep things to yourself. And if you have something in your mind, always talk and share it, and that will help you a long way.
Maddie, I'm hoping this is one that you might be able to answer. What's the biggest difference between just doing a biology degree and doing a medical course? And someone else has asked, what are health science degrees? So are you able to list some of them off? You're on mute.
I knew I'd do that at some point. So health science degrees, so that would be your nursing, midwifery, occupational therapy, physiotherapy, podiatry, cardiac physiology. That's what I would say is going to be your health sciences. my biology degree was very, very different. First of all, it's all theoretical. It's not, there's nothing sort of hands-on. You're not learning a trade, for want of a better word. Learning about biology was very much sitting in a lecture hall, nothing hands-on, a little bit mind-numbing, lots of reading, lots of writing. It was varied. My biology degree was varied. You know, we did genetics, we did plants, animal biology, a little bit of human biology, but it was all very, very general, not specifically tailored, unless you did human biology, for example. Yeah, so that's what I would say. That's how it's different. It's not designed to be hands-on. And a biology degree, it's transferable. So, you know, I had people that graduated with me that went into completely different careers. Like one became a wine buyer. You know, it's more of a foundation. It gives you excellent skills, but doesn't necessarily have to lead to a specific career unless you know, wanted it to.
Okay, so then I've got another one here. So when thinking about health and medicine as a subject, what made you confident that this is what you wanted to do? What research pushed you towards studying in this area? But you also might be able to apply that, guys, to actually how you're practicing now. You know, the subject that you studied, is it how it's applied in your workplace now?
Yeah, definitely. I think it's if I say for cardiology is very specialized in itself, and we work very closely to doctors, and medicine wise we do, even as a cardiac physiologist, you do advise, given doctors advice, for example, a therapy type of device or pacemaker. So we do take very high decision making, and to help work alongside the doctors, basically. So, and also there's so many clinics that we run as physiologists led, as doctors don't. So for example, the GP don't have an idea of pacemaker at all, so they will have to consult us. Non-cardiology doctor doesn't understand pacemaker, they don't understand echo, they don't, so they will still have to come us to physiologists. So yeah, we are very privileged in a way that we are very specialized and we know everything about the heart, and which is unique to share. So yes.
So someone else has asked, don't know if it might have changed since you guys have graduated, but do you get to choose where you do your placements? As in, do you get to choose which hospital you do your placements at?
Yeah, you can express an interest. I think when I was there, they sort of gave you where the placements could be, and you could put forward where you want to go. So, for example, if you knew very early on you wanted to go into pod surgery, then you would request the pod surgery placement. Or if, you know, for example, we had a few mature students that needed to be close to their family, so you are allowed to express, you know, you want to be near where you live or whatever. Yes, yeah.
I think similarly, so with the year of the cardiac physiology training, the first year you have 8 weeks placement, and then the second year you have 3 months placement, and then the third year you have 6-month placement. So the good thing with University of Southampton, they tend to send you in different hospital during your placement time, so that you have a good exposure to different healthcare setting, and also how different hospital work, how different department work. So it's always good. But for the longer placement, for like 6 months, it's also if there's a hospital closer to home, you can request. And nowadays they do try to support as much as they can, because long term, just think about it, 6-month placement in a hospital, and then after you graduate, that's your time to shine and impress, because there's a high likelihood you may get a job at the end of your degree there. So but that's another thing, because sometimes I know when you get your placement, you just take any job where you get before you move closer to home?
I'd really like this one answered on a bias, which is, is there a good work-life balance with the healthcare? Oh, it says healthcare studies, or is it difficult to achieve? I thought that was healthcare work. So, guys, how did you find your balance between studying and being a student?
You go first, man.
Oh, there's plenty of time to go out and have fun. Healthcare degrees, generally speaking, do have a lot of face-to-face time, unlike degrees like your humanities, like English. I remember that, you know, a couple of my friends would have a few hours of lectures, whereas I'd be in for full days. But it's certainly not going to take over your entire life. You'll have plenty of time to go out and party and do the things that you want to do. A little bit different depending on your career choice. Work-life balance can change a little bit when you start working, but it is what you make of it. You know, it's flexible. If you want to work less and live more, that's your prerogative, and you can do that.
Maddie, would you say that you have a better work-life balance than a nurse, though? Would you say that compared to the hours that they do? Because obviously we can't ignore that they're striking and they're on the news because then they feel overworked. Do you feel that podiatrists think that feel that they're overworked in compared to nurses?
I think to some degree everybody in the NHS work more than they're paid, and that is just part and parcel of working in healthcare, and none of us really go into it for the money. The nurses are absolutely amazing, and they work so incredibly hard, and they're chronically understaffed, underpaid. But what I would say is that's one of my reasons for going into podiatry as opposed to medicine or nursing, because it's really important to me that I do have a life outside of work. I work hard, but I also enjoy my life, and podiatry gives you the opportunity to do that.
I'm just going to add, so the balances depend on what you want to achieve. The 4 days a week you be at uni and you have 1 day off during the week. So I personally, I chose to work that 1 day a week in a cardiology setting so that I was getting a bit more experience and getting myself into what I want. And over the weekend, I was refereeing and a football coach. And on top of that, I had a young family then. So everything is achievable, and how you want to balance it and what you want to gain out of it. And I remember I used to commute from the Isle of Wight, get it, cycle, boat, train before I get to uni. So, you know, everything is achievable. But mainly with the degree, I would say, touching on which pathway to choose. Cardiac physiology, in a way, you can go up your salary banding quite quickly, in a way. So, for example, I'll say when you're a nurse, you can stay on a band 5 for a good 10 years still. But with cardiac physiology, if you choose some of your specialism, like ultrasound, echocardiogram, you do your British Cardiovascular Society exam, and then you can get to a band 7. Similarly, with a cardiac rhythm management for pacemaker, you do some of the exam, you qualified in it, and then you accredited, you can get to a band 7. So there's a quicker way to go the career ladder as well in cardiac physiology from a 5 to 6, 7, depending what you choose to do.
So we've got a couple of really specified questions. So I think we've got some people that might be interested in how we work with multidisciplinary teams. So someone's asked, would you be trained for being in these multidisciplinary teams? So when you're working with the nurses and the doctors, are you trained for that? And then another person has asked, at which stage do you collaborate with radiographers and nurses? What examples of expertise or conclusions do you and then offer overall for the treatment plan? So like, how do you work with these teams, and at what stage in your training do you get used to working with those teams?
So I'll answer that on how it works with my job. That's probably the easiest way. So I'm part of an MDT, and you can do that from the very beginning. You know, when you first graduate, you could work part of an MDT. It's just how it's set up in the hospital. Where I am, I'm part of the diabetic foot multidisciplinary team, which means one day a week I'll attend a meeting where we have a collection of patients that are under the MDT. They're normally high risk, complicated, multiple comorbidities, and I'll be there to provide the surgical opinion. So who attends that is the radiologist, who will go through all the x-rays, MRI, ultrasound, whatever it may be. If there's samples, so if it's an infected foot, for example, the microbiologist will be there to give their advice with regards to antibiotic cover. We may have the vascular surgeons there as well if there is peripheral vascular disease that needs treating, and then we have the endocrine team as well if the diabetes needs managing. Because these patients are so complex, it's not as simple as, you know, one size fits all. We come together to decide a treatment plan that works for the patient. So it may be that, right, that we're going to manage the diabetes first, or we're going to manage the infection first, and then we're going to operate. So I mean, I hope that answers your question. I don't know what Kish thinks.
Again, I will just answer from my job. So as part for, we do part like for heart failure team. So we do MDT as well for that. So for example, if our input is the echocardiogram, what's the result, and also what's the previous test, because sometimes we have to upgrade their device from a normal standard pacemaker to a heart failure type of pacemaker, which we have two leads on either of the side of the heart that deliver the energy to make the heart pump harder, because the heart failed before. So there's that, we're part of this. And what the easiest example is in the cardiac cath lab, when we have our angiogram, PCI, or emergency, we have a team of nurses, doctors, radiographer, and ourselves as a physiologist. So we all work together. Everybody have a specific role in the lab, and we are very lucky we get exposure to do intravascular imaging of the inside of the coronary artery. So I will be managing setting it up and make the measurement while the doctor do that, and then I measure the vessel and let the doctor know. Or the hemodynamic as well. Through that, we measure the narrowing of the artery, distal of the vessel, whether it's significant or not. But that's it. It can be shared between a radiographer and a physiologist, and we do. So with that setting, we all work within a team as a multidisciplinary team. And the other factor that we do is valve clinic, and then we got the nurses practitioner that get involved with us as well, who does a valve specialist clinic. So they all interlink a lot, and we do communicate a lot by everyone. I hope I answered the question.
Yeah, I think you did. Kish and Maddie, do you know how many students were on your cohort on the year that you graduated? I've got someone that's asking about numbers. They're just wondering, obviously it doesn't matter how many the university accepts, because you don't actually know how many people apply for these courses, but I'm just wondering how many were in your year, in your graduation year.
For me, it was around 15, 16.
Yeah, I think it was around 20 to 30. I think it was not that many, I don't think. Yeah.
And then I've got another question here, which is about like, how were you assessed when you were at uni? So is it exams? Is it coursework? Is it practical work? How did you find that mix of how you're examined and assessed over your degrees?
It was a mix. Yeah, all three: exams, practicals, you're assessed on your placement, coursework. So in that sense, if you've got a sort of preferred way of learning, you do get the opportunity. If it's not purely exams or purely coursework, it's a bit of everything. Yeah.
Yeah, it's the same here. We had exam assignments, and then when you are in your placement, you will have clinical assessment and case-based discussion as part of your assessment. So yes.
Hish, there's a really specified question in the question and answers for you at the end. Someone is developing, so I'm going to read it out as it is. I'm doing my HPQ on how developing technologies can be used to increase the effectiveness and treatment of the bicuspid aorta valve defect in adults. I was just wondering if you have a view or an opinion on the emerging technologies that are likely to be implemented in hospitals in the future. Great question, Joe.
Wow. Okay. Honestly,
Glad that's not for me.
Honestly, I'm not in a position to answer that. I definitely need to ask a surgeon. But if these type of patient for bicuspid valve, if we do pick them in early stage, they get referred for surgery, and then because their life expectancy is reduced with the bicuspid valve, so they get referred for surgery, aortic valve replacement, then to make it tricuspid. But most of them are bovine, from cow, animal, or sometimes they use, then can't think about the name now, but it's gone.
Porcine.
Yes, so and mechanical valve as well they tend to use. So yeah. But sorry, I couldn't answer that question straight because it's beyond my expertise, I would say.
That's fine. I've got a final question here for both of you. What's the best and the worst parts of each of your job roles?
Complications are the worst. Complications are inevitable and you can't escape them. They happen. They feel terrible when you get one. But that's, yeah, it's part and parcel, and you just have to work through it and do your absolute best for the patient and know that, you know, it's all going to be fine. But yeah, that's the absolute worst part of my job, is having complications.
I think again, the worst is when you done your best and you still haven't solved anything, you know, mainly when the patient sadly pass away. For me, I go run over the case over and over in my head, but I could have done anything differently if I've done that. But again, it's part of the team. But for me, sadly, it do run over my head. But the other negative side would be, I would say, as a cardiac physiologist, we are very short in this country. And so every department are very short. So you'll be overworked a bit, but it is what it is everywhere we have in NHS. But the positive side is I love my job, and the day-to-day we get to do the science bit, we get to see our patient face to face, and we make a difference in patient life. We contribute 80% of diagnostic to the cardiology, so we can't go wrong with that.
Tish just spoke about the employability. Would you say that's the same on podiatry, Maddie?
You'll struggle to find a podiatrist that can't find a job. There's not enough of us. You'll have a job for life. Absolutely. Yeah.
Brilliant. Thank you, guys. I'm just going to bear with me. So I hope the event has given everyone insight in where they want their health science degrees to take them. We are lucky to have had these fantastic speakers with us today. So guys, thank you so much. It's been really insightful. I think I've got through all of the questions that were at the side of the board. If you've enjoyed this online event and would like to explore other career areas, make sure you sign up for the last of where your degrees could take you event on the 21st of March, which explores careers in physics. So all of our events including this evening, have been recorded. If you want to rewatch any time or view any other event too. Would also really like you to encourage. Would also like to encourage you to investigate our diverse range of courses. A lot of you are asking what are healthcare professionals and subjects, and you can find that all on the University of Southampton's website. We have open days coming up later this year. If you want to come and meet the staff, find out from students, everyone's very welcoming. I've helped out at a few. They're very engaging and fun. Get to explore the campus. And if you're a current applicant, please look out for an invitation to the application visit days, which are coming up really soon as well. Applications are now open for our residential summer schools, so check those out and see if you're eligible for those as well. Make sure you apply. And thank you so much for everyone for being here today and our speakers for joining us today. So I'm Monique, the podiatry student. You can find me on Instagram under that name. And if you've got any questions, just direct them to the uni and I'm sure they'll send them out to the correct subject areas and get back to you. Look forward to meeting you all one day when you're all prospective students at the university. So thank you so much, Maddie and Kish. And if there's anything you want to just say as an outro, please go ahead.
So I would just say thank you everyone for turning up today, and I really hope we give you an insight of our career, mainly for cardiology point of view, and how it is on a day-to-day basis. But by all means, you can reach me, name Kish Turk, like I said, on Instagram, I'm there, or Facebook, or anywhere. You will find me, and don't hesitate to ask any question. And if you live in the Frimley local area, by all means drop by. You can have a look at the department here as well. So you're mostly welcome and good luck.
Yeah, same again from me. Thanks so much for having me. I hope that I have helped inspire a few of you to pursue health sciences, and yeah, good luck with everything. Have an amazing time at university, and yeah, enjoy it.
Thanks, guys. Hope you've enjoyed it.